Thank you so much for being here. My name is Sophie Pose. I am the Director of Strategic Partnerships for the Mayor's Office of Community Mental Health, and I oversee the program Thrive in Your Workplace. If you aren't familiar with Thrive in Your Workplace, we are a public-private partnership that works with local employers to integrate mental health support at the workplace. Our goals are to activate workplaces to help create positive cultures of mental health at work, to promote employee well-being, and to facilitate connections to mental health care. I am so delighted to introduce Matt Jackson, a partner of ours, who is the head of North America for Unmind. I'll allow Matt some time to introduce himself.
Thank you, Sophie, and good afternoon, everybody. So I am based here in New York. Our offices are on 14th and Washington, down in the Meatpacking District. So we're very proud to have our regional headquarters in New York City. We're a global company. We work with clients of all sizes across all different kinds of industries to do two things. So with our workplace mental health platform, we empower employees to take proactive care of their mental well-being. And we also provide employers with data and insight that can help drive their future well-being strategy to ensure that they're delivering on their goals as a business and supporting their employees. And I'm really excited to share some insight with you today from various different resources that we had. And I think we've got the perfect sized group for a good discussion. So Sophie, shall I run through the agenda? We've got kind of four main areas to structure the next, let's say, 45 minutes or so. One, we're going to just bring to the fore what resilience and burnout in the age of COVID looks like. So we did a little piece of research with the Wellness Council of America, and I want to mention a couple of interesting data points from there. Following that, we're going to look at a definition of resilience and what that means from a workplace perspective. And a quick heads up, we're going to be asking you what you feel resilience means to you and what your definition is. And feel free to answer on a personal level, but then also on a workplace level as well, because I think they do likely differ, perhaps. Maybe they should, maybe they shouldn't. That could make for a good debate. And then I'm going to share a little bit more around employer strategies. And there are 6 key areas in which we think you might want to look out for your employees and how we're supporting them in this next stage. And then we're going to have, don't think we're going to do breakout rooms, but we'll open up to a discussion depending on how many people join in terms of sharing across this group of what you guys are doing from a resilience perspective, what you would like to be doing, what works, what doesn't, and really just putting all our heads together to have a good discussion. So, as I mentioned, we partnered, should I say, with the Wellness Council of America, so WELCOA, on a survey that was designed to identify the current state of organizational burnout and resilience from multiple perspectives. So the study itself sought to identify what employers' challenges are when working to protect employee mental well-being, what's working best, and what the major concerns are for the future. To ensure that it was a kind of multi-dimensional perspective, we surveyed 1,000 US employees and around 230 or so US employers. The rest of the content that we show throughout here really is insight gleaned from, or a lot of what I will talk about is gleaned from that, and it complemented really nicely with Sophie in the Thrive in Your Workplace perspective as well. So the first thing that came up on this slide is around work-life balance. And employers cited that work-life balance is a top weekly to daily concern for employees. 51% of respondents say it's only become worse as a result of COVID. Now, when you look at what might be driving that on the next slide, I think this is something that will likely resonate with all of us. So despite there's a lot of conversation and discussion around the amount of time that remote employees are working, concerns over presenteeism, etc. But the findings from our survey suggest that employers are very clear about the impact that COVID had on employee work hours. So 64% of employers have seen employees' working hours increase since the pandemic started. And the majority, so around 44%, say that this increase was anywhere from 10 to 24% over pre-pandemic working hours. Like, this made me reflect personally to think, well, I did get used to not commuting to work, and that was nice, but the vast majority of us probably replaced it with more working time. And it became a lot harder to draw that line between home and work. I have a lot of friends in the city who would actually tape a box around their desk in their living room so that when they stepped outside of that box, they were like, right, now I'm outside of work, because it's so difficult after so long being trapped in that small space to differentiate between what's home and work. And this is going to have a knock-on impact on every part of a human being's well-being. I think, interestingly, more than the current state of burnout and overwork described by this survey, the findings begin to reveal quite a compelling story about an impending mental health crisis or mental health epidemic. So 43% of employers feel that the pandemic has negatively impacted their ability to help employees advance in their careers. And 65% believe that employee mental health implications of COVID-19 will negatively impact business performance over the next 12 months. And I think that's why it's such an important topic that we discuss. And it's something that employers need to address. One strategy to address these challenges is fostering resiliency. And that's what we're here to talk about today. And I think, Sophie, you've got some perspective on that for us.
Thank you so much, Matt. So before I offer this definition, I want to just note that oftentimes when we think of resilience and resiliency, it's seen as an individual responsibility and something that's a quality that employees bring to the table. And while this is true, some folks are raised in a way or have innate characteristics that help them to have a lot of innate resilience. There are things that employers can do to foster and cultivate resilience, which is really what we're here to talk about today. And so the definition on the screen, is broad. So what we read is the resilience is the psychological quality that allows some people to be knocked down by the adversities of life and come back at least as strong as before, rather than letting difficulties, traumatic events, or failure overcome them and drain their resolve. Highly resilient people find a way to change course, emotionally heal, and continue moving towards their goals. And so I think we can think about this in the context of one's personal life, right? We can think about negative life events like illness, loss, divorce, you name it. But we can think about examples from the workplace as well, right? For example, we can think about a restructuring. We can think about a big change management process that could be highly destabilizing. We could think about the assignment of a very large project that may be overwhelming or stressful. And so as we walk through this presentation today, think about the workplace as the anchor for our discussion. Before we continue, we'd love to hear from you. When you think of resiliency, what does it mean to you? Please feel free to share your thoughts in the chat, or if you feel open to, you are welcome to unmute yourself and share your thoughts out loud. And while you do that, Matt and I are also here to tell you what resiliency means to us outside of the formal definition. So Matt, maybe you can tell us what you think when you hear this word.
I mean, for me, my immediate reaction is a personal one, and it's probably to do with my kids. I always say I had an epiphany around mental health maybe 3 or 4 years ago, and my daughter was 2 years old, and I was getting used to becoming a parent. And for 30 plus years, all I had to worry about was myself. I created a very selfish world in which I lived in, right? And then having this beautiful small being fully responsible on me, I needed to understand, well, actually, resilience isn't just about me. There's somebody who's wholly dependent upon me, and what they do impacts me and what I do impact them. So resilience for me became, how do I provide for my family amongst just everyday life? It wasn't even particularly COVID adversity or anything like that, but it's, how do I manage my well-being to ensure that I'm looking after the well-being of others? And it kind of, resilience then took on a different, more holistic meaning for me beyond just the individual. But everything anchors in kids for me these days. With a 4-year-old and 2-year-old, life is very kid-based. But what about you, Sophie?
Thank you for that. I think of examples from workplace. I think about, colleagues who are in the same exact situation and who just have very different emotional responses to it. And I think it, for me, really is about keeping your eye on the prize and sort of on the big picture and not allowing small disruptions or small stressors to get in the way of whatever your larger purpose is. And that, I think, in the context of raising a child comes into play. I have a 7-month-old. So when I was dealing with a 2 and 3-month-old, really thinking about, how these sleepless nights really were feeding into this lifetime of happiness, I hope. And then at work, thinking about how, a momentary stress or frustration is actually an opportunity to strengthen the project or even to strengthen an interpersonal dynamic in the workplace. So those are my thoughts. And I see we have some participation in the chat. Thank you so much. So we have someone shared not allowing outside forces to shake your foundation. That's great. Another one here, sorry, I'm having some trouble here. The ability to bounce back if a door closes, open a window, that's beautiful. Being persistent in the midst of adversity, never giving up in the midst of a situation. Thank you so much for those reflections. I think those are absolutely spot on. And so I'm looking forward to going back to the slides here and telling you a little bit more about how resilience affects the workplace. And it has a very positive effect, not only on individuals and their ability to perform and to protect their own mental health, but on organizations. And so we know that resilience can buffer workplace stress and improve employee well-being. That, helps us to prevent burnout. It helps us to increase productivity. It can promote positive emotions, perceptions of work, and retention. That in turn can reduce turnover. So thinking about how resilient employees really can contribute as individuals, as individual contributors, but also as drivers of organizational performance. And in doing so can increase creativity, problem solving, and innovation. So there's no doubt that fostering resilience can be a powerful tool towards a mental health friendly and a productive workplace. So there was a really interesting study that was really a landmark study in the world of resilience conducted by 2 researchers out of the University of Chicago. And they conducted a 12-year longitudinal study of a telecommunications company that was going through a major deregulation process and in turn a big organizational shift in terms of structure, of roles. The entire workplace, in other words, was sort of upside down. And during the study, they noted that 2/3 of employees struggled with their performance, with their health as a result of all these changes in the workplace. And this actually led to physical health challenges like heart attacks, strokes, increases in obesity, depression, and substance use. Conversely, at the same time, 1/3 of employees actually thrived in this environment. So in spite of experiencing the exact same upheaval as their peers, they were actually able to come out of this transition with increased health, happiness, and satisfaction with their work. In other words, this change process had actually renewed their enthusiasm for their workplace. And so what the study sought to do, and I should say it was authored by researchers Madi and Koshaba, was to understand why 2/3 of the workforce struggled in the way they did and why the other third really thrived. And what they did is they came up with a new term, which we now know as resilience, called stress hardiness. And in very simple terms, and I think someone actually said this in the chat, it's the ability to bounce back when encountering challenges. And the good news is that they also found that resilience is a skill. So to be honest, for a long time, that resilience felt like it was something that was sort of innate, that some people had and others didn't. But this is actually not the case. And so in thinking about how we promote resilience at work, there are 3 major factors, the 3 C's, if you will: commitment, control, and challenge. And so commitment refers to really maintaining a steadfast dedication to our goals, and taking a genuine interest in the work that we do, in spite of negative workplace events or other stressors. In some senses, it's really about keeping your eye on the prize in spite of these barriers. And so what you can do as an employer to enhance a sense of commitment is about really clearly communicating goals, projects, and how they fit into the larger picture and the larger priority. In this way, you can actually increase a sense of commitment among your employees. The second is about control. And if you've joined other Thrive in Your Workplace trainings, we've talked a lot about how uncertainty and ambiguity can be incredibly stressful. And in the context of the COVID-19 pandemic, I think uncertainty has really has been a major theme throughout, both in terms of workplaces, public health protocols, you name it. And so COVID-19 is an extreme example, but there's often uncertainty and ambiguity at work. We don't always know why we're doing the work that we do. We don't always know what the outcome of a large project or meeting is going to be. But and sorry, one more thing to add, and people's sense of control is actually often about perception rather than objective fact. And so borrowing from mindfulness practices, you can build control by helping employees and helping yourselves really focus on what you can control and what you can't control. This can mitigate a feeling of powerlessness and increase resilience. So you could start that process by asking yourself, asking your colleagues or your direct reports, what can we do right now to improve the situation in some way? We may not know what's going to happen next week. I can tell you I am managing a project and I have been up at night about it. And it's because there are a lot of factors that are outside of my control. But what I can do is show up at work and try and preempt all of those open questions so that that stress is reduced. The final C is challenge. And so when we think about resilience, as we do when we think about mitigating the effects of trauma, we know that skill building can be a powerful tool. And many of us, when we confront a challenge, have a natural stress response. This can be a fight or flight response, right? Meaning you fight it, you fight against it, you try and prevent it from happening. You flee from it, you say, I'm just going to avoid that situation. Some people have a fawning response, which means they sort of cow in the face of the challenge. And so thinking about challenges as learning opportunities can make a challenge sort of a welcome task, right? Rather than a dreaded task or a fear. And so when we reframe challenges as opportunities to grow, we can approach those challenges with more creativity and less negativity, which can be incredibly detrimental, not only to our personal mental health, but the work of the organization. So I said at the beginning that the good news is that resilience can be cultivated. Resilience is a skill. And resilience is something that your employees can participate in cultivating, but that you as an employer can really put at the forefront of your work. Particularly during a pandemic, at least in New York City, seems to be coming under control. And many of us, as I am today, are back in our offices. So in the context of the WELCOA study and the insights gleaned by Unmind, Matt is going to share a few strategies that you can use with your employees and your colleagues to foster resilience at work.
Thanks, Sophie. I just wanted to make a comment about the definition of resilience as well. I think the comments in the chat are really interesting and they're all incredibly valid. I think what I always find interesting is that if you read through them, it's outside forces to shake. It's in the midst of a situation. It's bouncing back. It's in the midst of adversity. And that makes sense, right? I think resilience has become synonymous with the negative, like i.e. something negative has to happen for us to bounce back. And that's fair and it's natural, but I think there's a knock-on effect there that we talk about resilience or even mental health on in a negative basis, and that's not the way it should be. I think for so long as a culture, as an organizations, as society, we've lived in a world where you either have mental health or you don't. Mental health has become synonymous with ill mental health when it actually isn't that way, right? And I think we need to work as organizations together to rebrand mental health. Yes, there are ill mental health conditions and there are necessary support network services, solutions to pick people up once they've hit that point. And then resilience is assumed that you bounce back from that. But let's put a proactive spin on it. Let's put a positive spin on it. Because if you Google mental health now, it's a lot of head in hands, black and white images, very negative wording. And that shouldn't be the case. Mental health is, in my opinion, the single best thing about being a human being. It's how we feel love. It's how we feel pride. It's how we grieve. It's how we solve complex problems. It's something that should be truly nurtured and celebrated. And I think as organizations, we should challenge ourselves to not only put in place that safety net that exists to pick people up that need help, but to speak aspirationally about mental health, to think positively and think proactively. And together, I think the analogy I always hear is a rising tide lifts all boats. We're undoing 100+ years of lack of education around mental health. And it's going to take time to create that cultural shift. And I think thinking aspirationally and positively and proactively about these kind of things is so important. And you guys have shown that by joining this kind of call today. So thank you. I'll jump back down off my soapbox now. But I was contemplating that as you were talking through it. So redefining resilience in the workplace. We work with so many wonderful companies, and I genuinely love what we do because we work within the mental health space, and you can't really have a bad day when you're aiming to improve the mental well-being of millions of people across the work landscape. And in working with wonderful companies, we learn a lot of great things. And coupled with our WELCOA survey, we found some really interesting findings that I'm excited to share with you today. The first point, I guess, is almost like a quite a small caveat in that everything's going to be unique to you and to your organization and what you're able to do, what you're willing to do, and what you can achieve. And a great place to start is to understand how your people are feeling. You know, make all your initiatives specific to your organization within the boundaries that you can operate. And when we asked companies, we were fascinated to see that 63% of companies don't feel they have a strong understanding of the mental health and well-being of their people. What has made this even more fascinating is that over 70% have a mental health and well-being strategy in place, which begs the question, how effective is that strategy if the vast majority of people don't understand how people are truly feeling? And I think this is a hypothesis now, but that's because it's been incredibly difficult to measure and report out on mental well-being. It's a heavily stigmatized, a heavily personal area or a topic, and it's very difficult to understand that. And I think when you're faced with that dilemma as a workplace, there are certain things that you can focus your attention on that you know will have a positive impact on employees, no matter where they are on that mental health spectrum. So these are the 6 areas that I'm going to briefly walk through before we open up for a bit of a discussion. And we think these are 6 areas that we can cultivate resiliency during the next period of adjustment. I've referred to it as. I think there are many different things we can refer to what's going to happen next in this great city and beyond. So it's, and this is the word I always struggle with, anticipatory anxiety, losses of freedom, commuting, working relationships, role-specific challenges, and then specific mental health issues. So if we look at anticipatory anxiety, try saying that after a few cocktails. As humans, and Sophie touched on this, right? We find uncertainty hard to tolerate. And to reduce this discomfort, we tend to fill in blanks with our own narratives. So employees around the tri-state area now will be anticipating what work in the city will be like, and they're trying to preempt the challenges in their mind, and they're generating their own narratives. and they're imagining the potential threats it will bring. It's human nature. So this anticipatory anxiety can go on for months, and it perpetuates cycles of worry. When there's uncertainty elsewhere, work can, in fact, bring some order to the chaos. So some top tips here are that clear and consistent communication is absolutely key to limiting anticipatory anxiety. So contemplate these areas, formulate an official policy, and help your people digest it. Avoid saturating people with information, and always keep it within that in official communication channel. Be clear on how you are creating a safe work environment. Be clear on certainties. Don't make false promises. Don't have side channel conversations where you think you're saying the right thing to put someone's mind at ease. Be very clear on your certainties. And also ask your employees, right? Ask them what their main anxieties are, and perhaps tailor some communications to address these. So anticipatory anxiety is number one. I'm glad I don't have to say that word again for the rest of the presentation. The next one is losses of freedom. And I think while the last year did present some challenges, like for sure, for all of us in our own different ways, it also introduced some new freedoms. And returning to work as it was before will inevitably bring what are perceived as losses. So no longer can I wear sweatpants to work every day. No longer do I get an extra hour of sleep. My time with the kids is reducing. My home cooked lunches are potentially more of a challenge to make now and bring in, and so on. Now, these new freedoms will naturally have shifted some employees' priorities in life. And as employers, we need to be cognizant of that. So normalize that it's okay to have mixed feelings about returning to work. We're all going to be in different places to each other on this call in terms of where our feelings of comfort are in the next few months and weeks. Encourage discussion on what's being gained by returning to work to something that resembles more what life was like pre-COVID. Those water cooler moments, the ability, as and when it's safe, to hug someone, to have that side chat. We've been back in the office, socially distanced and complying with all regulations since February. And I've seen new employees ramp quicker than employees during our remote period. I've seen relationships strengthen because of that human contact. There are so many great things about coming back to work. So let's encourage conversations about that. And I guess the final one is consider whether you can offer to retain some of those freedoms employees gained during lockdown. And that, again, is going to be very dependent on what you're able to do, where you work, etc. But can we stagger start times? Can we relax lunch schedules so that people can get that gym workout in or that run workout that they've become so used to that's so important to their well-being? So those are the losses of freedoms. Next up, we have commuting. So I have to say, side note, I commute in from Jersey every day. It's been like getting a millionaire's train and having an entire path car to myself for the past 3 or 4 months. Wonderfully safe, wonderfully clean, and there's been so much space. And if you can contemplate what commuting on public transport was like pre-COVID, it is very, very different to that, but starting to see that buzz come in. That said, reconnecting with public transport will bring inevitable anxieties. I said I've been commuting since February. The other day, I needed to stand on the path for the first time. Now, I was in a car with more people, closer to those people, and I had to be very aware of the way that made me feel. And I'm fortunate that I work within mental health, so I understand that I need to be aware of that. I need to acknowledge what's happening and manage how I feel about that, but that's not going to come naturally to everybody else. So, and again, this will be very, very dependent upon your business and what you may or may not be able to do, but some examples to think about: can we allow for flexible working and therefore traveling outside of when rush hours where possible to allow people to ease back into that commute? Could we consider a phased return to work so that people are not doing the journey unnecessarily every single day? As an example for us, and this was very unique to Unmind, we had globally a 4-day in, 1-day out policy. We've now moved to a flexible policy. that you come in when you need to come in to collaborate or when you need to work in an office. Other than that, there's no expectation. To caveat, very specific to the type of organization that we are. And then again, this is all about communication, listening to employees, encourage teammates to share their concerns and help each other problem solve. It could be that there have been upgrades in the city to where city bikes now exist. And someone might say, well, hey, do you know there's a new city bike, what do we call it, docking station, 2 blocks away from where you live now. You might not necessarily need to get that number 1 train down to wherever the office is. So encourage people to talk and problem solve. Next up, number 4 of 6 is working relationships. Kerry on my team, she moved to Unmind in March of this year, and she'd spent a year at her previous company working remotely. And she said that one of the most overwhelming things of coming into an office was that there were multiple people having communication with her, above her, beyond her. And there were far more distractions, and there were people asking questions, and no longer were you confined to this little box that we have on the screen. And while she is a social person and she loves that, it was very overwhelming for her. And she worked through that in her own way, and she, was very open with us about it. And I think that is a good example of, an interpersonal challenge that we will face when returning to fuller offices. So people will have different views and approaches to staying safe. This could potentially give rise to friction in the workplace. Remote working might also have led to changes in the dynamics of certain working relationships. So some will have strengthened, others will have lost cohesion. For some, many may have experienced the intimacy of having one-to-one meetings in your living room, while for others, that prolonged social distance and disconnection may have created new boundaries. And we need to be very, very cognizant of there are going to be different people in different places when they're coming back. So in terms of some top tips here, be clear on safety guidelines that everyone is expected to follow. Make sure employees know how to raise concerns if they feel uncomfortable. This is something that I've found huge in any company I've worked, but always try to communicate the logic behind decisions. People may have different views and perspectives subjectively, but if you're bringing the objectivity to a decision and the logic, people can't argue with that. They can have a feeling about it, but they can't argue with the logic. So try and be clear and bring that logic to the fore. Encourage teams to reconnect between or beyond the usual team catch-ups. So we have, again, at Unmind as an example, ongoing commercial connections for the commercial team. And it just involves a communication channel that says, hey, I'm going to go work out, go for a run, play tennis, whatever it may be at this location on Wednesday. If anyone wants to join, feel free to join. And encouraging that organic connection amongst your team is important. And also capitalize on the humanness we've gained. So if we have learned things about each other that we wouldn't have known because we were working remote, and you'd see a small child walk behind a screen, or you'd see a dog walk behind a screen, or a cat jump onto a shoulder, whatever it may be, just encourage us to maintain that human touch, that human nature, because that, I think, has been one of the lovely things that we gained in the last horrific 12 months, that humanness and that connection. So 2 more role-specific challenges. So as well as the, I guess, emotional and logistical challenges that we faced, returning to a fuller office could bring role-specific challenges. The shift to remote work may have forced us to reevaluate our day-to-day duties, and certain processes or meetings may now be deemed unnecessary. This has great potential for streamlining how we operate, but it might also leave people feeling like aspects of their roles have been devalued or are under threat. And then on the other hand, you might have employees that feel like they may have regressed or de-skilled in the last year. We all went into survival mode, into treading water. So after conducting everything on video for a year, it wouldn't be unnatural for people to feel overwhelmed in meeting rooms or giving presentations, for an example. I haven't done an in-person meeting with a client or prospect since the pandemic began. I honestly don't know what it's going to feel like to be back in a room with other people again and presenting and standing up. Like that raises certain feelings inside. I'm very excited to do it, but it's going to be so weird. And what's weird to me, I will react in my own way, but there are many different ways that you can react. So just being cognizant of that's really important. So a few pieces of advice, I think: consider increasing the cadence of one-to-ones in the initial weeks of returning to the office to help employees get back on track. Show them you care, give them that opportunity to explore how they're feeling, give them opportunity to support what might get them back on track. Encourage open and candid reflections on what's changed and work together to see how we can adapt to that. We adapted to COVID and remote work. We will adapt to coming back to the work in whatever, into the office, shall I say, in whatever shape that takes. Where things have gone on track, aim to provide a safe space for open reflection where learning can take place. This is that kind of fail-friendly concept that we would be inappropriate to expect everything to run very, very smoothly when we return back to the office. So create that space to learn together. And then it's something Sophie mentioned earlier on around reconnecting your teams with the organizational vision, mission, values, and purpose. Why do I get up every day to come to work? What's my connection to the organization? What are we trying to achieve as a team? And bring everyone back into focus of what we can do as a team together. And the final point of the 6 is around specific mental health issues. So we've talked about everything in the context of what COVID has prompted and what created, but mental health challenges and issues existed for people before COVID. They're going to exist for people after COVID, and they likely will have been exacerbated during COVID, or they could have been. So it's important to be mindful of emerging or existing mental health problems within the workforce. New symptoms may have emerged or existing ones worsened throughout the pandemic. Returning to the office may also give rise to new symptoms. Anxiety, OCD, they may have emerged, and returning to an office will naturally present challenges as it relates to these. Depression will be a common reaction. And don't forget, people might also be processing bereavements, breakups, or making sense of strained relationships as a result of the pandemic. So in order to address that, to be cognizant of it, set up regular check-ins and make mental health a part of the conversation. To my point earlier, let's not shy away from it. We're all in a very important and powerful role to destigmatize mental health and make it a part of the conversation in the same way that you talk about physical health and dental health. It should become the norm. Make sure everyone knows how to access the incredible support that you already provide. On the reactive side, on the proactive side, on the early intervention side, make sure it's clear of how to access that and how to utilize it. Equip managers and leaders to recognize and respond to mental health challenges. This doesn't mean make everybody a clinical psychologist or a psychiatrist. This means empower people with the basic knowledge to identify the symptoms of common or complex problems so that then they can triage people to the necessary resources, rather than as something happening and it then going unnoticed and it appearing further down the line when somebody is at the point of more of a clinical or behavioral challenge. Offer skill building and growth opportunities to enhance that sense of purpose. Again, this goes back to what Sophie discussed in terms of the study that was done. Bring people into the boat, let people feel like they have a space to grow, to develop greater skills. And then finally, I think create opportunities for social support and connection. An interesting anecdote from our own data from our platform: we measure, or we empower employees to measure across the 7 core areas of well-being. And those 7 areas are happiness, calmness, coping, connection, fulfillment, sleep, and health. And they cover your whole person as an individual. So your psychological life, your physical life, your social life. 2 of these measurements, so connection and calmness, when COVID hit, the report back, or the measurement that employees were reporting, saw a huge spike downwards in calmness scores. Naturally, once COVID hit, we didn't know what to do. The calmness level or stress levels went through the roof. At the exact same time, connection scores went through the roof. Now, we looked at this and thought, that's odd, that can't be right, because it was pretty much the same. If you think about a chart, connection went up, and to the same degree, calmness went down. And I think that was because when we were then confined to our homes, confined to Zoom, to house party, to FaceTime, whatever it may be, all of a sudden we made that additional effort to connect to people, to connect to our loved ones, to connect to our colleagues, to connect to our friends, to connect to people that we infrequently talk to, because we sought resilience and we sought strength in connection and community. And that's something that we should take into this next normal, to create opportunities for social support and connection, because we are social animals and we thrive in that social environment. So I think number 5, or the final one there, is so incredibly important. So those are the 6 top tips that we have. Hopefully they're useful. And again, it'll be very dependent upon the organization that you work for, what you're trying to achieve, what you're able to achieve. But we wanted to open it up. So rather than breakout rooms, so if you think we'll do just a discussion, and people feel free to write in the chat, feel free to come and speak openly here. But what resonated? I think the first question on that slide was, what opportunities exist at your workplace to foster resilience? Is there anything that you came into this call thinking, we're going to do this? Or is there anything now that you're thinking, we could do this? So what opportunities exist for you to foster resilience?
Thank you, Matt. I'm just putting the questions in the chat for everyone.
Wonderful. And actually, if you would rather kind of strategize on what challenges that you see, and you're thinking that's all really nice, Matt, that you say all this cool stuff, but how do I overcome this, this, and this? Let's use our collective brain power to see if there's anyone else experiencing the same challenges.
And you're welcome to chat or unmute yourself and join the conversation.
Hi, my name is Tangia Small. I'm the Health and Nutrition Manager for Community Parents, Inc. We have 2 Head Starts in Brooklyn and 1 in Queens. I'm at the Queens site. We've actually been back since June of last year, but the children came back in September. So we went through a lot of what you're saying, but these are all great tips. Like even now, we still are, it's all a healing process, So for us, we actually had an opportunity to be a part of UCLA. They have a health, I forgot the name of it, but it's a health collaboration. And we went through like talking about what can we do, to help with resilience and promote mental, health in the, for the staff. It was all about staff wellness. So we're actually doing a staff wellness retreat this June, and we're really excited about that because it's going to have a whole lot for people to do, but it's really for people, and we called it coming out of COVID. So it's we're looking forward to that. But because of that, we really discussed a lot of different things, and we had to come up with a plan as to what we're going to do. So we're definitely looking at a lot of different ways to promote resilience. We're at a place where we're really trying to make it about healing. We understand that staff are at different parts, even the fact that some, people are back to work and some are not. We know it's just a big transition for everybody. So, for us, that's what we're really, looking at, meeting people where they are and, giving them the tools so that they can recover from this. And we're even going to have like peer support starting in September, because we realized that a lot of us coming back, a lot of it was hard because many people didn't understand or know where the management team was, and where we were. And when we came back, we had all the guidelines, and we shared everything before they came back. But the biggest part was, they need that peer support. We realized that's going to be a more effective tool when they know that they're not alone, and it's going to be, led by the mental health consultant. So that's just a few of the things that we're doing.
That's fantastic. Thank you very, very much for sharing. The retreat sounds brilliant. I imagine a lot of logistical thought has gone into that. And did you happen to test the comfort level of folks to do something like that before suggesting it? And
Yes.
the response was positive?
Yes, I'm glad you said that, because even with this thing that we collaborated with UCLA, they did a survey before we even started it. So they did a staff survey with questions about coming back to work and everything, and then they're going to do another one next year. But for our retreat, my director put together a survey through SurveyMonkey, and they had questions. Are you interested? So right now we have about, at first it was 70%, and now we have about 75% that are going to go to the retreat. And those that are not comfortable, they have the option to stay on site and still benefit from it, because we're going to have Zoom training. Even though we're at a retreat, everybody has their own room. We're still doing social distancing. And even those that are still staying behind, they'll still have an opportunity to be a part of all the trainings. There's going to be one-on-one with different facilitators. So we're really excited.
That's fantastic. And it just shows how adaptable we are, right? That we can make something like this work and just as effective for everybody, no matter where they are in their comfort levels. So that's really good to hear. Thank you so much for sharing.
You're welcome.
Does anyone else have any thoughts or anything they would like to share before we wrap up and send you on your way for maybe lunch if you haven't eaten it already?
Hi, my name's Heidi. And one of the biggest challenges I'm facing, I work for a city agency, is we have been so successful working from home. Staff is reluctant to come back. They have the subway fears, all of that, but they're feeling we made all of our deadlines, we made all of our commitments, we even came early on some. So why the return to work? So return to office. I'm sorry.
I hear you. As a city employee myself, I'm in a conference room right now with the door closed and my mask off. But I think I've heard this from my colleagues and the folks that sit on my team. And I think this is, the big question, and the one that when, Matt was discussing the losses of freedom and how to reframe that, I think that this is the area that I find most challenging, but also the most impactful, because it's, even being at the office now, I get the attention of folks on these side chats. I have one-to-one time with the director of our office that may have had to be scheduled before. And so thinking about not only the human connection, but like the access and the efficiency that's built into these one-to-one conversations without having to send a formal email to say, hey, I just want to run this idea by you. A lot of that creativity and that brainstorming ability gets lost when it becomes like a formal email request, right? So that's the thing that I think I've enjoyed and benefited from the most in my few weeks back at the office. But I agree that it's been hard to communicate that to folks who haven't come back into the office, because it's really about the lived sort of those moments, like living through those moments and seeing what the better that comes from it. Matt, I don't know if you have anything to add.
Yeah, I think it's a really tricky one. And, I mentioned before in our UK headquarters, they are just coming out of a severe 3-month lockdown. And the people team have suggested that if you want to come into the office, come in to collaborate, but don't feel that you need to come into the office every day. And it's very easy to say that. And to Sophie's point, like, people get such great value from collaborating and being in person, but I can be so effective at home, right? And the challenge that comes with that is it's all very well, but I have real estate to pay for, and I need to work out how much space we need as an organization. So I think what Sophie said around the collaboration aspects, it's articulating to, I think it was point number 4, that discuss what is great about coming back to the office, but to the degree that you can be flexible. Maybe there's a consideration from an organizational perspective that do we need a new path forward in terms of why people are in the office, how frequently people are in the office. but it's going to be super dependent, Heidi, I guess, on what it is you're able to do. But yeah, it's a tricky one.
I will say the last point is there's someone on my team who currently has an accommodation, and the concerns were really about safety. And so I gave a little FaceTime tour of the office, just to really emphasize the amount of space between desks. I showed him how empty the elevators are, how they've been upgraded. And it sounds like a small thing, but I think it was actually quite reassuring to give him a glimpse of the physical space without having to actually be there. So another suggestion, another idea to try out.
Thanks. I am actually in the office today. We are supposed to come in 1 day a week on staggered days. More than half of my staff has reasonable accommodations, so they're not coming in. So everything is still being done through Teams. I was in 1 day and there was one other staff person here. That's the most that I will see at one time. So, but we'll get there.
Yeah, we will. It's hard. And I think the challenge is at what pace do you want to get there and why do you want to get there? And there are a lot of questions you probably want to ask that when you articulate the reasons why, it gives you a clearer path to where you want to get to. The challenge, as you said, is if people are super effective and everything's been great from home, it creates a bigger debate, right? Thank you very, very much for sharing, Heidi.
Thank you. Thank you.
So conscious with 4 minutes left, we'll wrap up now. I think the one I wanted to just share, I asked our internal psychology team at Unmind to, I guess, tell me how they define resilience beyond the ability to bounce back. And it's funny, I wrote bounce back in my notes, and I know that we've had bounce back in the comments here. These were my two favorite answers. So the ability to effectively cope with change, shift gears comfortably, and make decisions without having the total picture. And resilience is a process to harness resources to sustain well-being. I hope that what the past 50 minutes or so has shown us is that resilience is a combination of a lot of things. It's not easily defined, it's nuanced, it's complex, and most importantly, it's specific to the individual and to the organization. What I hope you all feel is that it's clear that to support employees in their endeavors to develop resilience, we must focus on providing solutions and outlets across the entirety of that acuity spectrum, from prevention to early intervention to reaction. So that's it from us today. Thank you so much for joining us. We really appreciate it. If you want to learn more about Unmind, we're at unmind.com and we're on all of the socials. I think I didn't even include Facebook. I think we're yet to have a TikTok, but we are on Twitter, Instagram, and LinkedIn as Unmind HQ. As I mentioned, we're a proactive workplace mental health platform, and we're working with companies of all shapes and sizes, and I'd love to share more with you if you're interested. If you want to search for yourself, there's plenty of blogs, handbooks, white papers, webinars available on our website and socials. Thank you so much for your time today. Sophie?
Thank you so much, Matt. Really appreciate sharing the space with you and everyone else that joined today. I just want to emphasize that mental health support is available. If you, a loved one, a colleague could benefit from mental health support, everyone in New York City has guaranteed access to healthcare, including mental health care. So there are low or no cost services available, and these are available regardless of insurance coverage, age, immigration status, or ability to pay. We have a guide on our website that provides basically an FAQ and some navigation to different kinds of services for different kinds of challenges. So I encourage you to take a look. And you can follow at Mental Health NYC for the latest updates on mental health programs that are launching, interesting data points, you name it. And with that, I thank you for joining us today. A copy of these slides will be shared with you, as well as the recording, which you will be able to find on our website in the coming week. So thank you so much. We appreciate your participation in the chat, and hope you have a wonderful day. Thanks.